Talking about Sherri Ozawa. And Sherri actually also is a close friend, and she is a good friend. And she has been a leader in the field of patient blood management for more than 2 decades. And her background in critical care nursing has enabled her to create one of the largest and most widely known or widely recognized multidisciplinary patient blood management program in the world. And everybody would know, right? The Patient Blood Management and Bloodless Medicine Program in Englewood Hospital, New Jersey. Sherri has actually lectured throughout the United States and also internationally, with particular focus on the creation and implementation of sustainable, organized patient blood management programs. And we know too that Sherri has actually published a number of numerous peer-reviewed abstracts, posters, book chapters, and also articles. And currently, also she is working on the group, the task force on a WHO program that is on the PBM implementation, as well as she has been involved with the first U.S. federal government grant via the Department of Defense, funding the creation of organized training program for physicians and other healthcare professionals in the field of patient blood management. And Sherri actually has received the Award of Excellence of Bloodless Medicine and Surgery Society in 2019, because she has actually done an excellent contribution to the science and practice of bloodless medicine and surgery. So yes, we would like to welcome Sherri Ozawa, and she would actually be presenting on the nurse as a bloodless medicine educator. And she will be telling us on the experience from the United States of America.
So today, this morning, wherever you are, I get to talk to you a little bit about the nurse as a bloodless medicine educator and some experience from the United States. I hope, again, that this is applicable to places far beyond the United States. So a few of our learning objectives to look at some of the basic principles of nursing care. I'm going to bring it back to some of the basics, but I know that we are not all nurses on this call, so some of it may be news to some of you. Talk about the nurse's role in communication, coordination, and especially education in bloodless medicine and surgery program settings, but of course we'll cross over a bit into patient blood management. Explain the participation of other nursing staff. We spend often time talking about the role of nurse leaders or coordinators, but what about other nurses who work in healthcare settings and hospitals? What is their role in bloodless medicine and surgery? And talk a bit about the concept of blood health. For those of you who are at SABM, I apologize that you'll have to hear a little bit more of that again. So I'll start with really what I think nursing really well embodies. We all in healthcare attempt to take this approach, which is the approach to patient-centered care. But I really do think this ties well to what we're going to talk about for a few minutes in the role of nurses as both educators and communicators in these settings. The Institute of Medicine, which of course is not called the Institute of Medicine anymore, but it defined patient or better aptly termed person-centered care. And I won't read all this to you. Many of you know these points, but this type of care, and I think this is so key in bloodless medicine and surgery, respects and responds to individual patient needs, preferences, and values as we make clinical decisions, really as partners, right, with our patient. Must acknowledge patients' experiences, stories, and knowledge, provides care that focuses again and respects patients' values, preferences, and needs by engaging patients more, and requires that we as healthcare providers, not just nurses, all of us, but I think really others in healthcare can learn a lot from the foundations of nursing to fully engage patients and their families in this care process. So again, these are all very easy words to say. I don't think we would disagree with any of this, but of course, as healthcare becomes more and more complex and more stretched, especially in this era of COVID, which is not over, right? Really having patient or person-centered care can be all the more challenging. So a little bit about the background of nursing. I won't get too much into a history lesson, but I think it does inform sort of the evolution of where we've come, both in patient blood management and in bloodless medicine. This is a rating that gets done every few years. It's a couple years old. I don't think a new one has been done. At least I haven't been able to find it. but always rates, of course, America's U.S. most trusted professions in terms of honesty and ethical standards. And you may not be surprised that nurses continue to come up on the top, along with, of course, our physician colleagues pretty close behind, Congress people and car salesmen way on the bottom. And we're not here to make fun of those folks, but nursing continues to really be more highly rated. And I would expect, although I don't think the data is out, that may be even more true since the era of COVID. This is a very nice article from the literature that it's the Journal of Oncology Nursing from Europe, but I just really like the way that this describes nursing as the 21st century nursing is the glue that holds the patient's healthcare journey together in so many ways. And again, we're here to talk a bit about education, but I think this applies in so many ways to what nurses, particularly in bloodless and PBM programs, do. So again, a little bit of history about the beginning of nursing, and I have to move my own little Zoom screen here so that I can see my own slides. So the first history of really was recorded as nursing as we may know it today is during the height of the Roman Empire, around 300 of our common era here. And the empire was pretty progressive, right, in many ways, and sought to actually place a hospital. We know about their roads, but they also sought to place hospitals in every town. And the term nurses, or at least I guess the Latin term, was assisting in these newly created facilities, became more popularized actually via the Catholic Church in Europe during the Middle Ages. But of course, we all know the name Florence Nightingale. In preparing this talk, actually, I learned a lot about her history as well. And so, much of what she became initially famous for happened in Turkey, where she was dispatched during the Crimean War to Scutari with 38 nurses, and everything was really a mess, as it often is in war. But soldiers had all these terrible things happening, dysentery, frostbite, cholera, like the infectious disease, and just a horrendous situation. And she seems very logical to us now, but she argued for better sanitary conditions and really showed results, right? Process and implementation and results from that with her structure, and the mortality rate in these folks went from 42.7% to 2.2%. And it's pretty careful statistics, right, for something that happened so long ago. But really it was because she was one of the early trialists and kept very, very careful records of what she was doing. So after this experience, it wasn't just, we always hear about her and I think the Crimean War. We don't really know what happened after, but she wrote these notes that impacted the health efficiency and hospital administration of the British Army. She did actually a study and created these notes, which really dramatically changed how things were done in the system. And she did these questionnaires to hospital administrators, and she analyzed the results. She produced these findings, and she really said this was an interesting quote: "Understanding statistics is to understand how the world works, is to understand the mind of God." And so really there was a huge change in the way military medicine was delivered throughout hospitals throughout Great Britain, and Parliament actually voted to continue to finance this work. So you may know these are called we call them Cox Combs graphs, actually. That's not exactly the best name for them. I'm trying to get this here. Polar is actually in the bottom, is really the accurate name for them, but she was able to use these sort of epidemiological graphs to track. So actually that's why we do know that mortality changed. And it's really quite an interesting application, but she was really the first trialist. And she said that throughout her career, and this sort of reminded me a lot of those of us who have been at this field of bloodless and in PBM for much of our careers, she really faced resentment because she was going against the grain, regarded her as an interloper. And she herself said, "There's not an official who would not burn me like Joan of Arc if he could." She wrote, "But they know the War Office cannot turn me out because the country's with me." So, first and foremost, she really was an educator, an advocate for what was right, and a trialist, but really was the mother or grandmother or great grandmother of modern nursing. So as we continue this journey in nursing, and I promise we will tie it back to where we are with bloodless medicine and surgery and what I was asked to talk about, the role of nurses. But these early nurses, even after the time of Florence Nightingale, really never went to official nursing school. And we know what I mentioned to her history a bit, but during the 20th century, formal schooling developed for nursing and included then specialization, as there is in medicine, with fields like orthopedics, peds, critical care, right, psychiatric nursing. And now nurses have moved far beyond this into advanced practice roles, business roles, administrative roles. So although nurses' role really was rooted in the vocational norms here of hold on a second. Oops, I went backwards on my slides. Of motherhood and homemaking. Really, nurses have developed this ability to be compassionate, caring, communicative, and have these highly valued skills that are critical to patient-centered care and deeply valued by patients and families. So although those are not necessarily what are highly valued, sometimes thought of as soft skills, they're critical in really patient-centered care. So these are some of the roles of nurses. This may not be their exact job title. Sometimes it is, but, you know, coordinator, communicator, leader, manager, researcher, etc. And now really in terms of roles and licenses and credentials, there are expanded roles of nurses as clinical specialists, practitioners, et cetera, and these many more advanced practice roles. So I talk a bit about, you know, changing the image. And I think that we in bloodless medicine and patient blood management have helped to move this image along in our roles as leaders in the field. But this was kind of our traditional, right, image of nursing, wiping the brow of the surgeon when he was working so hard, always a he, right, being there behind and supporting, but really the modern role of nursing, and these again are just stock images off the internet, but I think the idea really is we don't know who in these pictures is the nurse, who's the physician, who's the administrator. Nurses' roles have expanded, and again, here in the United States, not unusual at all for nurses to be CEOs of large health systems, hospitals, with many types of other professionals reporting to them because of their both their education and abilities, but again, I think their training and the fundamental principles of that underlie nursing is, again, communicators and educators and collaborators really make them excellent leaders in healthcare systems. So we'll get into the education piece for the last few minutes here, but this is a really interesting study. I like this one out of the Iranian nursing literature, where it talks about nurses as facilitators to professional communication. It was actually a qualitative approach to this, but described nurses as the mediators of communication, as the educators. This is a slow building slide, sorry. At the core of communication, as the mediators of patient and manager communication, patient-physician communication, executor, though, of other people's duties. And it also examined this concept of the unfair workload, increased moral distress, and high levels of unkindness, really that nurses still experience in all parts of the world. So nurses really are the hub of communication, relaying and interpreting information between physicians, colleagues, caregivers, families, patients. And I do like the sentence, the ability to establish effective communication in nursing is imperative, providing the best care. So it seems obvious, seems easy. It really is sometimes more challenging than we think. So with all that background of what nursing, where it came from, where it is and where it's going, how does that apply to what we're here talking today in terms of bloodless medicine and surgery? And I am, as some of our other speakers have, expanding into patient blood management. And so you've seen this diagram probably before, where these are two obviously related fields, but much of this has overlapping principle, really almost everything, again, voluntarily and with permission, stolen from Steve Frank from his slides. But I did add a little bit of content here because, again, outside of the overlapping in this Venn diagram, there are some elements that don't exist in the other, right? So specific, and this is where we're going to spend our time talking today about, in bloodless medicine and surgery, specific education and documentation and other things that are specific for our patients for whom blood is not an option, right? And then on the other side, outside of that overlap, for some patients, blood is an option and they indeed may receive blood as part of their care clinically, but much of the rest of what we're talking about in both PBM and bloodless are overlapping. But specifically, what is the nurse's role in this? So we're going to talk and divide this up a little bit. You know, there are, again, nurses who are dedicated bloodless or PBM leaders. You see some of them, some of them are on the call right now. In the picture on the left from a pre-COVID SABM meeting, some of my friends and colleagues who are nurse leaders, specifically in PBM. But we'll speak a couple minutes also about the role of other nurses in clinical settings in PBM or bloodless programs, even if they're not necessarily leading programs. So we're going to see how both of those work. So how about the clinical? And it may not be called that everywhere, but maybe let's call it the bedside nurse in bloodless medicine and surgery programs, even if they're not in leadership positions, offering compare, compassion, and support, part of all nursing roles, but especially in bloodless medicine and surgery settings, these can be really emotionally, socially, and ethically challenging. And these patients, like all patients, may face things like fear and pain, but particularly in bloodless patients, they may be further distant than other patients from friends and relatives. There may be some lack of agreement amongst family members about their position on blood transfusion. And again, this population often has had previous difficult experiences with the healthcare setting. So from every level, but especially from that bedside nurse, these patients may require and deserve an extra level of care, compassion, and support. So a little bit about the education piece, again, because that's what I was asked to talk about today. So I like to bring this concept of health literacy. You've probably heard that term as common now, I guess, in the United States anyway, as something that's very important, right, for all patients, all the population to have improved health literacy. So certainly all patients should have opportunity to improve their health literacy, but there are some specifics to bloodless patients in which they really do require more and can be helped to achieve a higher level of health literacy. Things like blood component derived therapies, what some would call blood fractions, right, or devices or techniques that use the patient's own blood. So their literacy in those areas can be, and we might argue should be higher, perhaps, if we can help them achieve that. Than other patients, but also for those nurses and some of my colleagues here on these leadership roles in PBM and bloodless settings, really helping be part of these multidisciplinary care teams and do education on a continuous basis with the public, the community, other nurses, physicians, other provider colleagues, and staff members. And there are people on this call today who are exemplary and have been doing this in an amazing way for years. So if you are out there and you need some help to understand how you can either work with your nurse colleagues to optimize their communication and coordination skills to help in your PBM or bloodless programs, or you yourself need help, there's a plethora of people who are anxious to help you just on this call alone. So again, aside from the normal, I think, and even extra health literacy concerns, in bloodless medicine and surgery programs, patients need some additional education and deserve it. And there are often mechanisms in place here in US settings, and I know in other countries as well, about education related to patients' rights and responsibilities, as concept of what we like to say in bloodless medicine and in PBM, informed choice as a better term than informed consent, much more accurate. And again, education related to specific documentation, specific for bloodless patients. We know that documentation is an important issue to make their wishes known beyond just blood or no blood, right? We get into more nuances of different therapies that may or may not be acceptable to these patients. So that education piece is tremendous, really crosses over, into education and advocacy, I would say. So again, back to the bedside a little bit. What is the call to action for nurses, not just in leadership positions, as being at the bedside and taking care of the body's liquid organ? My anemia word was black, I'm sorry, but assessment, I won't read all this to you, but those on the call are familiar with these concepts of nurses assessing and inquiring and monitoring. Nurses really are, the bedside nurse are really in the best position to monitor how patients are or are not tolerating anemia, looking for any evidence of bleeding, right? Inquiring to make sure we are doing the right thing for those patients. And what we will call competing strategies. You like to use the alternative word, right? Competing strategies to allogeneic blood transfusion, but really more important, focused on that patient's own blood, and then monitoring and documenting, right? What happened as we treated that patient? Did the patient have the expected response or adverse reactions? Nurses really, again, can advocate for those patients and keeping their own blood healthy, right? And that's what we're talking about. And so how do nurses impact these clinical decisions? And I won't read all this to you. You can have these slides anyway, but, vigilant observation and this proactive care. Nurses are leaders in patient care and safety and are empowered to be vigilant. They can have a large role in monitoring, of course, patients' signs and symptoms and lab work, on iatrogenic blood loss, and they are able to impact many aspects of what happens in a hospital. Again, if you go back to that earlier slide about the glue that keeps the whole healthcare system together, they're leaders and innovators in change management, solution finding, patient advocacy, education, and again, leading to better outcomes. So you probably have seen this before. We did this a few years ago. I won't show you this whole thing, but we did survey about 100 institutions that reported patient blood management and bloodless medicine and surgery programs via an online tool. And I'll just point out that at that time, when we asked about oversight of the program, it was about 50% or more had oversight. So these are these leadership roles. I suspect this may be even a little higher now if we were to do this again, but nurses are in certainly management and leadership roles. And it's exactly what we like to see for successful patient blood management and bloodless surgery programs here in Australia, as we're discussing this World Health Organization implementation guide. This has been a big topic of conversation as to really what constitutes success and likelihood of sustainability to a PBM program or bloodless program. And it really is, this group feels anyway, off the record, that it is in large part the role or the existence of a dedicated nurse and nurses to keep the whole thing going. So to finish up, some of you saw this at SABM, but I think this is where we have migrated to in terms of how we see what we're doing. For years, right, we talked about the disorder of bleeding and anemia, and the default treatment became blood transfusion, and bloodless medicine, as we had in the title of this conference, really became a game changer when this was not an option, as they are in bloodless centers. We really had to restore the state of equilibrium. And what really happened to that is these modalities came into play. This is pulled out of some old bloodless medicine and surgery brochures. Many of us still have them in our programs. We may have updated some of this terminology, but these things all came together really. And this is a lot of where the education lies, right, for nurses and others and programs helping patients understand and avail themselves of this. These things all really came together to really turn into what we now call patient blood management. Of course, bloodless is, again, the cradle of that, and still at the heart of much of this is our updated definition. You see on the side, you've all heard that as that patient-centered again, and that's where we started this talk, and nurses really exemplifying that concept of person-centered and patient-centered care, but pointing again to that the patient's own blood as the most precious resource, this concept of blood as the body's liquid organ and one to be protected, and really this concept of blood health, which I think fits well in line with, again, the principles and background of nursing as a profession, really for all of us, focusing on the patient's own blood, health maintenance, and really where we now are not spending our time looking and worrying about transfusion or no transfusion, discussing that, especially in the bloodless setting, but we really want to spend our time paying attention to the patient's own blood health, maximizing that and keeping that as healthy as it can be in the patient's own veins. And if you're not aware, we are designating February 13th as World Anemia Awareness Day. More to come on that. Hoping to work with multiple other societies, both medical and other type of organizations around the world to help bring awareness to this, which again is about the patient's own blood. And that's it. So thank you